Healthcare is complex. It relies heavily on the skills and efforts of many individuals. In Canada, 1 in 10 employed people work in health. The distribution of healthcare providers is constantly changing. It is influenced by many factors, such as both internal and external migration. Understanding and measuring where exactly these health professionals are located and how they move within the country is critical to the proper planning and management of the healthcare system. How do their distributions and migration patterns reflect recruitment, retention, and access to care in Canada? The Canadian Institute for Health Information worked with researcher Roger Pitt-Blado to explore these questions.
We used Statistics Canada's Census of Population data as well as Scott's medical database to explore the distribution and migration of more than 20 different groups of healthcare providers within Canada.
From 1991 to 2001, there was an overall increase of 8% in the numbers of healthcare providers in Canada, compared with an increase of 10% for the general workforce. Percentage increases for healthcare workers ranged from 11% for physicians to 80% for medical sonographers. But there were also some decreases. Licensed practical nurses, for example, dropped by 12%, and there were 19% fewer medical laboratory technicians. When it comes to the proportions of men and women in the healthcare workforce, there was little overall change. The majority of healthcare workers continued to be females. Their proportion varied from a low of 21.7% for denturists to a high of 98% for dental hygienists and dental therapists. And how old are they? Physicians were on average the oldest Canadian health professionals in 2001. They averaged 48 years of age, 7 years older than the average age of the general Canadian workforce. At the other end of the spectrum, dental assistants were on average the youngest health professionals at 35 years of age. Between 1991 and 2001, the average age of a Canadian worker increased by 1.5 years. Overall, Canadian healthcare workers are aging faster than the rest of the Canadian workforce. For some professions, this increase was more dramatic than others. In particular, registered nurses, licensed practical nurses, and medical laboratory technologists saw their average age increase by 3.9, 4.1, and 5 years, respectively. When examining the number of health providers per 100,000 people, the nursing profession far outweighs any other single health profession, followed by physicians. In 2001, there were 1,016 nurses per 100,000 population, a decrease of 13% from 10 years earlier. For physicians, the rate was 189 per 100,000 in 2001, an increase of less than 1% from 10 years earlier. 1991 to 1996 saw more people moving to rural areas, but between 1986 and 1991 and 1996 and 2001, both the general population and the healthcare workforce migrated toward urban settings.
As a whole, the healthcare workforce is more mobile than the general workforce. Of those who moved, most moved from one community to another within the same province or territory. Those healthcare workers who did tend to move from one province to another did so in higher proportions than the general Canadian population. In fact, most provinces and territories have experienced net losses of healthcare workers.
Where did they go? Over the past few decades, their principal destinations have tended to be the large magnet provinces of Ontario and British Columbia, or neighboring provinces. In 2001, Alberta took the lead as the primary destination for health professionals in Canada.
Analysis of the migration of our health human resources is important because, among other things, mobility influences or is a reflection of some of the critical issues of health human resources planning in Canada. Access to health care, continuity of care, the recruitment and retention of health care providers.
To date, very few studies have been undertaken on the geographical distribution and mobility of most healthcare providers in Canada. This stems primarily from the fact that there are limited sources of data upon which to base such analyses.
In spite of some limitations, the Canadian Census of Population was able to provide a good first glimpse at these distributions and mobility patterns. As specialized health human resources databases, such as those belonging to CIHI, continue to grow and mature, we will be better able to build on this work.
A detailed summary of these findings is available in the CIHI report, The Distribution and Internal Migration of Canada's Healthcare Workforce. Please see www.cihi.ca for more information and to learn about the migration and distribution of specific professional groups.